morning, everyone, or good afternoon, wherever you are in our world, our big, big, juicy world. Hope you're all doing well. We're so happy to have you here today for the Health and Show. My name is Marilyn Shannon, and we're going to get on with our show. But let me just remind all of you as we proceed, you are welcome to join us in our chat. Just put your name, nickname, whatever you like under the window, and it'll open up. You're welcome to comment, ask questions, whatever you want in there. You can also contact us through 919-978-5118. Gosh, I just forgot the number. Hold on a minute. Let me look it up.
919-518-9773.
I don't know how many years I'm saying that, but anything is possible, right? So please join us in any way you can. Also on Skype, which would be voice at computers. That's plural. Then the number 2K voice. That'll be voice, not video. So let's get on with our show. And besides, Amnon, thanks for everything. Our producer in the background, keeping everybody straight and happy. Thank you for everything.
Oh, no, don't mention it.
So thank you all. This is a subsidiary of HWC, Homeopathy World Community. We have lots of things going on throughout the month. Check out our website, and we'll give you more details about that in a bit. But let me introduce Chanel, our beautiful Chanel. How you doing?
I'm good. How are you? Hello, everyone. Good to see you all.
How are you doing?
I'm good. Cannot complain. It's sunny and warm today, so happy to be moving around a bit. And I'm actually very excited for today's show because we have Monica FROHMANN on today. She is actually was a mentor of mine and a supervisor while I was in school. So this is very exciting for me. Monica FROHMANN, I'm just going to do a quick introduction. There's not enough time to go through all of the accolades, but she studied at my alma mater, the Canadian College of Homeopathic Medicine in Toronto, and has been in practice since '99. She also treated my beloved Gooch, who is now turning 18. So I think that we can all agree that he has had a long, long life because of homeopathy and Monica. She's currently working in Austria as a homeopath and craniosacral therapeutic practitioner, having moved her practice from Newmarket, Ontario, Canada in 2017, I believe. She treats all ages and has a specialty for animals of all sizes. And one of the great things that I always remember about taking any course with Monica was her references to horses, which I think is absolutely amazing. And we'll touch on that a bit today. She's also on the World Council for Health and Homeopaths for Medical Choice. So welcome, Monica, to the Health and Show.
Thank you. Thank you very much for having me. It's very exciting to be here because for me, any opportunity to talk about homeopathy and other, like any kind of complementary healthcare methods is just always a joy.
Marilyn, we can't hear you.
Our audience may not know anything about craniosacral. So before we get into some of the nitty-gritty stuff, maybe we should just give our audience a nice little base of what that is.
Sure. Okay. So I studied craniosacral therapy primarily so that when I moved to Austria, I would have a therapy to get started with. And one of my mentors always said to me, the one thing you have to do if you're going to be a homeopath is you have to have some kind of a body work that you do along with it. And for many years, I was like, yeah, sure. Little did I know how important it was. And I did actually end up getting a proper education through the Upledger Institute, and the combination of homeopathy and craniosacral therapy, which we'll talk about more later, is absolutely astounding, the things that you can achieve with it. And craniosacral therapy basically relies on a completely separate system of that functions in the body from the blood pressure, the heart rate, or the breath. And it can be detected with the hands by putting your hands on, at the beginning, hands on a head or on feet are the easiest way to feel the sensation of the craniosacral fluid flowing. But later, as you get better at it, you can sort of feel it almost anywhere in the body, depending on where you touch. And the concept is you can think about craniosacral fluid. It flows through it flows in the spine, but it addresses every part of the body. And it gives energy and health and vitality to every organ. There's almost no organ that the fluid, the cerebrospinal fluid doesn't in some way or another address. And so by us as therapists, what we can do is we put our hands on and we can sort of steer that cerebrospinal fluid so that it does what it's supposed to do again. So if you take into it, let's say you take into account that you've recently been sick, or you had a car accident, or you have a lot of stress in your life, the way the fluid, we'll call it CSF to make it short, to know how it's flowing or that it's flowing well, you feel something very smooth that flows back and forth. And if it's not flowing smoothly, and sometimes it's like a zipper that gets stuck, you can feel it like that, or it goes, it stops and starts and stops and starts. That indicates that there's some kind of a blockage somewhere that needs to be opened up. And by opening that blockage, and you can look at it as though it's like a reset for the body. And the CSF flows and stops naturally every day, all the time. Excuse me. But we can make it stop by a very, very light touch. No heavier of a touch than like placing a nickel on the back of your hand. If you feel what it feels like to have the weight of a nickel on your hand, that's all that's required to stop the CSF from flowing. And then we allow it to start up again on its own. And that's when the reset has occurred. And you can do that in various different parts of the body. And as you become more practiced at it, you can feel the places in the body that are struggling. You can feel injuries, even if they're older injuries that haven't resolved properly. You can often feel that an illness is coming, and by doing so, you can support the body's immune system. And Dr. Upledger, the founder of the craniosacral therapy, he called it the inner physician. So the body already knows what's happening there. And as the therapist, you're like the conduit or the communicator with the inner physician. And then you just direct the energy into that part of the body that needs healing. And so most people, I won't say everyone, but most people feel it as it's happening. They feel various different types of sensations in the body, and they can communicate that with me as they're going along. And oftentimes I'll be able to say, you're feeling this in, the spine or in your right knee or whatever. And they'll say, wow, how did you know that? Because I have my hands on their head, right? But you touch the head, the feet, the spine in various areas, the abdomen, and you work your way through, and it addresses both physical and emotional issues. So that's kind of it in a nutshell. It's very deep acting, very long lasting. It's a very lovely adjunct to homeopathy.
I never realized how I just thought it was like a really good massage for your head. I never realized all of this. This is incredible. So
yeah,
go ahead.
I was just going to say, it's actually nothing like a massage because there's no deep tissue manipulation whatsoever. It's super gentle, and many people fall asleep. Some even snore. And afterwards they feel either totally wiped out for the rest of the day. And I send them home with lots of instructions like drink lots, have a nice Epsom salt bath, and the next day they feel like a new person. Some people will walk out of here completely revitalized immediately after. It really depends on their level of illness or state of health and vitality.
And so how do you, and this may be putting the cart before the horse, and maybe there's more questions, Chanel, and if there is, just, say so. But I'm just curious, the intersection between craniosacral and homeopathy, and where is that, and how is that related?
They're not related as such, but so Samuel Hahnemann, the person who was the inventor of homeopathy or the founder of homeopathy, has said that it's necessary to include some sort of energy work as an adjunct to overall health with homeopathy. And what I find is that if people combine the two, they come in and they have their homeopathic appointment, it's a two-way street. It works both directions. Let's say someone comes in just for a homeopathic appointment, and I suggest that because of various reasons, I think they need a craniosacral appointment as well. By doing the craniosacral therapy, it allows the remedy to act more deeply and for a longer period of time as a result, because it clears away the blockages. It makes for a purer receiver, so to speak. But it can work the other way too. And as a homeopath in Austria, actually, primarily I work online in Austria, because in Austria you have to be a medical doctor, a pharmacist, or a midwife in order to practice homeopathy legally. So I start my patients with craniosacral therapy, and then sometimes a little bit next to that, they'll get a remedy. And what will happen is that having the remedy with the craniosacral, it enhances the action of the cranio and it lets it last longer. So with some people who, without a remedy, they might need another appointment a week later. If you combine it with a homeopathic remedy, they don't need it again for another 3 to 4 weeks. So they in both ways, in both directions, they enhance each other's actions. And both of them alone are also tremendous forms of medicine.
Fascinating. Yeah.
Yeah. So, I mean, in that same line of thinking, when we look at young children or trauma, so you had mentioned, being in a car accident or a long-lasting kind of trauma. After childbirth, craniosacral with homeopathy, or would you suggest you start with something like craniosacral and then move on to the remedy? Which sort of direction would you go into that? And I know that it's patient based, it's always the first answer we give. But in terms of the type of gentle relief you get from both, fast acting relief you get from both, in terms of childbirth and or the child being born.
So I started here with a great amount of good fortune, I guess you could say, because I had been going around from doctor's office to doctor's office, introducing myself, trying to find someone who would support me as a homeopath so that I could practice homeopathy here, but also obviously get started right away in craniosacral. And one of the doctors very close to where I live, his wife is a midwife, and she sat in on our meeting and she said, "Oh, well, you have to start here right away." And so I rented a space in his office for about 3 weeks. And we all realized that it was going to be far too many patients. He only had a space available 2 afternoons a week, and he needed the room on other days. And so his wife, the midwife, went right away and knew somebody who had a space for rent in this lovely clinic where I am now, and talked to the people who were there and said, "I have this person and she has to work in this town and we need her for our babies." And so I started right away with a big practice of babies. And I would say that starting any baby, no matter what the birth was like, can benefit from craniosacral, but it also seems to often need a remedy. However, a few days after birth, the mom or the dad doesn't know the baby very well, so they can't really report symptoms to you. And unless something traumatic happened that you can take the case of the birth process itself, it often is a little difficult to prescribe for a newborn. But you can right away do something with cranio. It's gentle, it has a deep acting effect. And the person who is now my secretary or an assistant, she came to me with her daughter 9 days after she was born. She had done nothing but cry. Both parents were in tears themselves because they couldn't sleep, they couldn't rest. The baby wouldn't eat, she wouldn't nurse, she wouldn't sleep, and she cried for 9 days almost continuously. And so the husband was like, this isn't going to work. This is nonsense. What you're going to do just by putting her hands on her head. And I did. And the second I put my hands on her head, she stopped crying. And then for several days later, the baby slept normally. So even though she was only 9 days old and we couldn't really take a case because the parents were so overwhelmed, they didn't have any information to give me except all she does is cry. They weren't even able to tell me, does the baby sweat? Does the baby chilly? Nothing. They could only hear the crying and that was it. So we didn't do anything with a remedy right away. We simply did a treatment of about 20 minutes of craniosacral therapy. And within that period of time, she was quiet the whole time. The dad is now a patient as well. And they're regular patients, and they've brought also more people into the practice. And the mom is now my assistant. So does that answer your question? I think I went at it at a roundabout kind of way, but I think that answers the question.
It prompted me because I now remember that my grandson, who's now 4, I think when he was, I don't know how old he was, but I remember now that my daughter took him to a chiropractor who did craniosacral, and I can't remember what the issue had been on him, but I mean, just a few times actually.
Yeah.
And he's whatever, I can't even remember, but whatever it was fine.
Yep, it doesn't take many appointments. Some people just like their kids to come regularly for maintenance, and some people bring their kids right before school starts or when exams are coming. Many times the birth itself is very traumatic, so they might need a few appointments, 2 or 3 appointments in short succession to resolve any birth trauma. And by the time you're into the appointments, like the 3rd or 4th appointment, then the parents start to get to know their kids, and then you can also include the homeopathic remedy, which now I understand why, both my mentor and Samuel Hahnemann said we need body work in addition to just homeopathy.
I think you mentioned earlier, that people bring you, let's say, their children for different reasons, right? And you mentioned, when they're starting school or before exam, what does it do that helps with your taking an exam?
A lot in the kids who are taking exams, it depends on what their concern is. Are they nervous? If they're nervous, it helps with the nerves. Are they, do they have trouble concentrating? Do they have exam or stage fright type of sensation? Can they not concentrate? Can they not retain? So I do a bit of, I might go about my craniosacral therapy appointment somewhat differently than the average person would who isn't a homeopath, because I'll sit everyone down at the beginning of the appointment and talk to them about what's happening in life. And I want them to address what's happening with them in order to know what's going to improve as well. Because I think it's not just about coming in and relaxing. It is a therapy. And so I have to know what the problem is so that I can address it properly. There are definitely other types of therapists who use it and just feel their way into it and see what they feel. And that certainly works. There's no question. I'm just trained a bit differently, right? Because I'm a homeopath. So I like to know what I'm feeling. And I also like to feel like I know what's going on physically in case there's anything I need to avoid. I had a patient once who had a broken back and had not that long before and still had the stitches. I want to know that before I sit down and I put my hands on it. So I think that the answer to that is it depends on what the problem is.
No questions, but yeah, I don't want to leave you out.
And I wanted to move from, treating, I guess I have one more question about treating kids, because this is something that I've run into quite a few times as a practitioner. And I know that a lot of practitioners stay away from certain ailments because of how difficult they can be to work through homeopathically. It takes, certain issues or symptoms can be very, very difficult. You either don't have the specialization in it or haven't worked directly in just that. I'll use attention deficit as one can be extremely difficult to treat if you're not used to the signs and the symptoms of it, or, working a child through something like that, or even an adult, can be very difficult because of the high energy often involved. Have you found that working with craniosacral therapy has really kind of honed in on the usefulness of remedies and how effective they are in cases such as ADHD or the high energy diagnoses, like something like MS, which is a very high energy diagnosis, very difficult to treat? Have you found that using this therapy has helped in your practice?
Yeah, I would say that I'm trying to think of an example in my head. So craniosacral therapy is pretty amazing because it works even if the patient is unwilling, same as with homeopathy, and also not terribly cooperative. So I have all kinds of tools to help me work in my office with kids that are super hyperactive. And I have like audio recordings for them to listen to. I have toys, I have puzzles, I have books. And it's when you find something that they're interested in, anything except a computer or a phone, and I have to tell you something about that in a minute. When they're distracted, then I can feel what's happening, and when they're sitting still. But there are also some kids I've had to chase around the room in order to get my hands on them, and that's okay too. It works. I mean, it's a little more difficult, and their body is maybe not quite as receptive because they're not as still. But what I sometimes do find that I'm doing is giving a remedy first and letting the whole system settle, and then I'm able to get my hands on them and be a little bit more effective that way. I do find that there are some situations where I'll say this is a case for homeopathy and not for craniosacral. But I've never done the reverse where I've said this is a case for only craniosacral, because there's always room for homeopathy. So somehow I feel like I'm answering your questions vaguely, and I don't intend to, but they're pretty wide open questions, which allow for a lot of room for different types of interpretation. Sorry?
I was asking Chanel if she had more to that question.
Oh, and yeah, so then I guess the second part of that would be, are you working with animals with craniosacral?
I do. Yes, I do. I treat a lot of horses, dogs, cats, but mostly horses. I have a group that I'm a part of on Facebook called Horses and Homeopathy, and we treat and help and inform people all over the world. Basically, anyone who wants to join the group is allowed in. And so those people are more distant, and the ones that are local, I have a lot of farms around me. I have 4 horses of my own. And as a result, you meet other horse people. And so I go to different farms and treat horses and stuff. It's pretty great.
So what would we see with a horse that you are treating? I mean, what's the before and after?
I would love to be able to show you physically what I would do it for you in front of the camera, but it would be too embarrassing. They stand there, and when you first get there, whatever their problem is, they're more agitated. Their head is up because it might be because it's someone new around them. And then once you start to put your hands on them, the head goes further down, and then all of a sudden the ears sort of go out to the sides, and the lower lip sags, and then sometimes they drool, and sometimes they fall asleep. Horses can sleep standing up, so their knees lock, and you can tell they're just so relaxed. And they'll breathe out or snort. And you know that once you hear that snort or that big sigh, then you know you've done your work. It's pretty obvious. Horses are really, really excellent mirrors as well. I never mentioned this. I guess I could have mentioned it, but I do that. I also do therapy, horse-assisted therapy. So it's people who need therapy but don't want to go see a psychologist. They come to me, and we have a session where my horses basically are their coach, and there's no riding or anything involved, But horses are so amazing because they have almost as many expressions of facial expressions as a human does. And so they're perfect for mirroring people's attitudes, fear, anger, hostility, whatever. And they're also amazing at being like a metaphor for whatever the problem is. So you name the horse, I don't know, George or whatever, because George is the person that this person has a problem with, and they are able to talk to George, but George is the horse. And so after a session of this kind of therapy, my horses are also allowed to relax and become themselves again. And then they also get a session of, or a 10-minute treatment of craniosacral to balance them back out again and let them stop being George and go back to being the horses that they are.
I mean, there's a question on the chat that I want to ask you, but I think one of the first things I am so kind of curious about is, what's your purpose?
Wow, that's a loaded question. At the moment, given the situation in the world, I think my purpose is to make homeopathy a household word. It should become a go-to for anybody and everybody, and not just for the few people who understand what it is or have used it before. And which is why I'm agreeing to do all types of podcasts and interviews and stuff like that, because I really think that, and which is the reason also why I'm part of the world, I'm on the medical council for the World Council for Health as the homeopath, and certainly not to gain notoriety or anything else, but simply to make homeopathy a household word.
And in your opinion, why?
Because this is going to sound very biased, but it's absolutely true. It's the most deep acting, long lasting form of medicine available. And I probably will ruffle a lot of feathers by saying it's more effective than almost any other kind of complementary medicine, because it's based on a system of medicine. It's based on a system that is repeatable and can be learned as opposed to just felt. And I think that, craniosacral therapy is also the kind of medicine that can be taught and learned, but there are going to be some people who are better at it than others, because some people have just more feeling, more energy. They can perceive energy differently and better than others. But homeopathy, if you can understand the system, anyone can do it. And because also the reason why I want to make it a household word is because we do no harm with homeopathy. We can treat anyone for anything. We can treat anything from, the common cold to, you brought up multiple sclerosis, cancer and beyond. I'm having recently a lot of cancer patients and having huge success treating cancer. There's almost nothing that you can't treat with homeopathy. Over the years, if people have said to me, what does homeopathy treat? I say the shorter list is what it can't treat. So the reason why is because of its efficacy. It's a deep acting, long lasting, no dependency, no side effects. It's amazing.
Marilyn, you said you had a question from the chat.
Oh, yeah. So we have somebody who's asking us a question in the chat about the relationship between craniosacral and Reiki.
They're very different. Reiki is purely an energy form of treatment. It treats. I'm not a Reiki practitioner. I don't know very much about it, but I do know that it treats the body energy. And as a craniosacral therapist, I'm actually using the body's internal cerebrospinal fluid to nourish the body and bring it back to health. It's an actual observable form of observable function in the body. If you want a really quick history, Upledger was invited to a surgery for a guy who had I can't remember what he had. I'd have to go back to the book and look at it. But he was invited to an open brain surgery, and what he observed was that he was watching the cerebrospinal fluid flowing, and he was pretty sure he was losing it because he didn't think there was such a thing, that you could literally see it moving. And from that, it's a longer story. You can read about it in his book. But from that, he developed a system that it could be manipulated in some way. So it's very different from Reiki because Reiki is purely energy.
So in Reiki, you don't move the energy, or you are moving the energy, but not the fluid.
That's right. Yeah.
Got it.
Yeah.
Got it. Okay.
And I think that depending on the practitioner of the craniosacral therapy, some people will bring in more energy work than others.
Got it. So I know homeopaths ask a lot of questions, right? In order to kind of position something, unveil it, unravel it. So when you're working, and I realize that with kids, you don't have that opportunity, or with an animal necessarily, but I guess with the horses, they express themselves, or an animal can probably express themselves. What is it? So I guess, what does something feel like when you can't ask the question, or you don't have the question or the person to ask, but you're working someone? What does something feel like allergies, or something specific that you're working when you can touch it? What does something specific feel like? I'm just curious, like, what does it, I mean, I can understand what some, like, stress could feel like, right? Because when you massage stress, you can feel the knot. But how do you feel other things?
I think that the answer, depending on who you're asking, is going to be different because everybody perceives things differently. But it all actually, interestingly, it started with my mentor who told me I should be doing some sort of body work. And he said, come over here and just take your hands and don't touch me, but just run your hands over a certain part of my body, like just over the arms, whatever. So I did, and I went like this over his bicep. And I said, have you been working out or something? It seems like your bicep muscle might be sore. And he said, exactly. That's exactly what I've been doing. I've been working out, and I have lactic acid buildup, and my muscle hurts. And what happened in that instance was I felt my hands being drawn more towards the muscle, as if there was a magnet there. And so I think over time you just start to recognize those clues, or those little things that happen in the body, and you go, okay, well, sometimes you can name it and sometimes you can't. So I've had a patient who I had a cancellation, and he was waiting for a massage, and then there was some kind of a weird because I'm in a clinic with other practitioners, and there was some kind of a weird thing when everybody's schedule was messed up and I was free and massage therapist wasn't. So he came in to see me completely unannounced and unplanned. And I had my hands on his abdomen and on his spine, sort of like this, like a sandwich. And I said, I feel something here. What's happening? Something pretty serious has happened in your abdominal region. And he turned all white, and he said, oh my gosh, I can't believe it. I actually had my bowel resected, but that was so many years ago. I can't believe you could feel that. And I can't explain what I felt. I just felt this energy that was different. And even just today, I had a lady who has had cancer, and she had a skin cancer, and she had it removed, and it's been very good for a long time. And today I told her to go back and get it checked because it doesn't feel the same as it usually does. I wish I could, but I cannot explain it to you. It's just a feeling.
How do you take care of yourself?
Huh.
How do you take care of your hands and your senses and your emotions and your mental state? I mean, because you are very much a part of, as all of you homeopaths in general, but and also as a body worker, sort of, kind of, I think. How do you take care of yourself? Because you are a very important instrument in all of this.
Thank you. That's nice of you to recognize. I do. I think you should ask my husband whether I take care of myself.
Where are you?
I think you should ask him if I even take care of myself. He would probably say I don't. I kind of come at this from it's who I am approach, and I'm a package. I'm not just Monica. I'm a homeopath, Monica. I live, eat, and breathe homeopathy, and without it, I wouldn't be who I am. So for me, it doesn't seem like a burden. I don't feel like I have to disconnect from it. from the craniosacral work, I do need to have some stuff in place so that I don't take on a lot of energy. Because that can happen to me. Someone comes in with a backache, I might feel the back pain. Someone comes in with terrible headaches and I might feel the headache. So I have to go into every appointment being grounded. I try to wear certain shoes that I know I can feel the floor beneath me. I always have both feet on the floor. There are these little spots that you can massage right here, right, called the scalene muscles, that help you release energy and tension. And I also limit how many craniosacral appointments I take in a day. I will do a maximum of 6 of those, and I don't care. With homeopathy, I would do 20. It wouldn't matter. It's a different type of work. I do get to hear what people have to say. I feel their energy when they're talking about their homeopathic symptoms. I can empathize with them, but I can hear it from a more clinical perspective, perhaps, with some degree of. I'm absolutely empathic. There's no question about that. But I don't feel like have to get into their story to feel the empathy. I just take it from an observational point of view, and which is the reason why we can treat children and animals, because we have to observe them. We have to be able to step back out of ourselves and just see what's happening around us and observe their facial expression, their body temperature, what the skin feels like, the color of the skin, everything, the breath, everything that you can observe, which is why I think I don't get too immersed in the patient when it's a homeopathic patient. I'm too busy being the observer.
You got to, anyone themselves. You are the radio wave. You're receiving the information and you're putting it out. So you've got to take care of that radio station that's receiving.
For sure. I mean, I work 4 days a week, most of the weeks, and I take vacations, and that's a very good thing about Austria too. People are given automatically 5 weeks of vacation per year, very much unlike it is in Canada or the US, where you get your 2 weeks and that's that. So that helps as well. But like I said, I get home after a hard day at work, and then I get out my homeopathy. But I always used to say to Chanel will probably remember having said this. I'm a homeopathy geek. There's no 2 ways about it. So I go home and last night my husband's like, "What are you doing?" And I said, "Oh, I'm just studying a remedy." And he just rolls his eyes, He's a car guy. He does the same stuff with cars, right? So
that's fascinating.
So I have one question, and then I kind of want to switch gears. Have you ever found that, so when you're doing craniosacral work and you feel, however it is that you feel energy in a person, or you feel a blockage or that zipper versus, the easy flow, have you ever found that, and I want to be really careful how I say this because I hate kind of the way that this gets used sometimes, but if you have a patient that isn't a sulfur patient, but maybe needs sulfur in the moment, will you find that what you're feeling is in that space, that the heat, it's versus a patient who is extremely cold? And have you ever noticed anything like that, where the actual sensation, when you're looking at the picture of the remedy that they may need, there's a direct correlation between your experience doing craniosacral work and
absolutely. I can often, I'll start questioning the patient. So it depends on which appointment it is. If it's the first appointment, I've already warned them we're probably going to talk throughout your appointment, and subsequent appointments they'll be more quiet and just receiving. And I can ask my questions based on what I'm feeling to help me confirm my remedy. This morning I had a patient who I touched the back of her neck, and she's ice cold, but she's sweating. So I'm like, "Oh, so how are your bowels? And what's your digestion like? And how much do you like eggs?" Right? Because I'm touching a calcar patient, but I don't know if you don't have both things, it's a thing about experience, right? You have to. People think I'm a fortune teller, right? Because I'm like, oh, but I won't say, hey, I bet you have, but I will ask in that direction, and they're always amazed that I can say, that they probably like eggs or that they're super thirsty, because you can feel the dehydration in the skin, or that they have. Okay, a menopausal woman, it's not outside the range of normal to expect them to be sweating, but where the sweating is more, or that kind of thing. And like I said this morning, she had it's absolute. And then I took her case more, and she truly was a calcarb. Sometimes I'm proven wrong, but because I do my due diligence.
Hold on a second. What is a cal what?
Oh, a calc carb, calcarea carbonica. It's a certain remedy that is sweaty but chilly, has poor digestion, tends to be somewhat overweight sometimes, a bit sluggish. And this totally described this patient this morning. So even though she was here for craniosacral, I asked her those questions to confirm her remedy.
Because I remember being in class, and I remember you saying you'll get to the point where you'll know that you know a lot about a remedy when you're either sitting on a bus or a train, or you're at a dinner party and you can see the remedy picture, people around you. And I was thinking about that this morning, and I was wondering if there was a correlation between the two therapies, because I find myself doing that all of the time now. Like, is this sepia? Does this person really need sepia right now? Or, someone gets angry about something, you're like, definitely lack of this. So it happens. I wanted to know if there was the correlation between the two. I think that's one of the amazing things, because homeopathy is this so all-encompassing form of medicine, that anything that adds on to it has to pull from what we know in homeopathy.
Absolutely.
So I think that's it.
Yeah, it's wild. And I guess that's why people think I'm a fortune teller, right? Because because it's only because I know my remedies. It's certainly not because I'm a fortune teller. I leave that to the experts.
I've heard you mention about being on different boards or whatever. Is craniosacral is not anything you can do remotely?
I don't do it remotely, but there are people who do it remotely. I have no opinion about it. Personally, I can't see how, but that doesn't mean it can't be done. I think I don't know how many people are watching or listening, but I wouldn't be surprised if someone in your chat said, I have it done remotely and it works for me, because I know that there are people who do it. But I'm a little bit too much of a pragmatist to be able to say that I fully believe in energy work, and I fully believe that you can treat people from a distance, but craniosacral is about manipulating the CSF. So I personally do not have that skill.
I got it. I can understand that. It makes good sense. So I think I want to ask everybody out there, for those of you listening, and there's a lot of you, if you've had experience with craniosacral in your life, I would love you to put some comment in our comment window and just share, like, what's been your experience? What was your situation? What is it? I don't think, based on what I'm hearing, that everybody goes to craniosacral because they have a specific issue. You could just go and prevent a specific issue.
Absolutely.
So, that's probably the best way to do it, right?
Yep.
But do it, right? So if anybody's got any comments or anything, please put it in there. We'd love to read it and just see what kind of interesting things are happening around, because it is a fascinating thing, and it's always even more imperative, I think, when you hear the results of someone, that it kind of puts it even more on the map. So I would, it would be interesting to see. Chanel, what else you got?
I wanted to ask about the program that you're putting together for German speaking. They wouldn't be homeopaths yet. If for people who would like to study homeopathy and would like to study homeopathy in the German language.
Okay, so I live in Austria, and Germany and Austria, I live about 1 hour from the German border. And the rules in Germany are completely different as far as homeopathy is concerned than they are in Austria. In Germany, you can practice homeopathy without any education, as long as you are what's called a Heilpraktiker, which means a naturopath, basically. And you do your education in naturopathy, and it's very heavily based in pathology and pathophysiology, et cetera, so that, and it even allows you to do more than a naturopath in Canada could, for example, because they're allowed to use needles, they're allowed to do therapy, like, I don't even know what it's called in English, where they use your own blood and they re-inject it. No idea, whatever. Horrifies me, but whatever. And so I started to look around as to how I could be involved with homeopathy without treating patients in Austria and getting myself into trouble. And I thought about maybe setting up a practice in Germany because I'm only an hour from the border. And then I started looking at options about teaching. And there was this distance education school in Germany who wanted to actually be able to teach homeopaths, but they didn't have a course. So they asked me to write the course, and it's still a work in progress. It's like working through molasses because there's tons of red tape that has to happen. Every time you finish a module, it has to go to the government authorities. It has to be approved. It has to be tweaked. Been doing this for 2 years. I'm over it, to be honest. But I'm still working on it, but I'm over it. In the meantime, they're selling their course on Schüssler salts, on the cell salts that I wrote. But the homeopathic course is still a ways away because there's just so much red tape to go through. But I thought my hope was to have it finished so that people who were these naturopaths wouldn't just go out there and do homeopathy willy-nilly without a proper education in it. And unfortunately, it's just taking forever to get out there. In the meantime, I have a few other ideas on the back burner that I'm working on. Hopefully will be confirmed by the end of this week, but I don't want to tell tales out of school until I have them confirmed. Yeah, exactly. Cross fingers. But because in Austria, there's a whole different form of education in homeopathy. You have to be an MD. And then if you want to use homeopathy in your practice, you can. With only about 50 hours of education in homeopathy, they're allowed to prescribe. Or if you're really interested in homeopathy and you want to be a homeopath primarily, then you go on and you study in almost the exact same way that we did at Canadian College of Homeopathic Medicine. They have almost exactly the same curriculum, the same theory, philosophy, everything. And then once they've completed that, then they call themselves a homeopath and they hang up a shingle and they do their 2-hour initial consults and the whole bit. But they're not covered under the healthcare system if they do a homeopathic consult. They're only covered if they do like an acute consult and they give a remedy, then that gets covered. Not the remedy, but the treatment. But if they do a chronic consult, then the patient pays out of pocket, just like we would in Canada.
I'm not a homeopath, but I obviously have the highest regard for everyone who practices. And it's just a fascinating, brilliant system. It's so interesting as an observer and a learner and a community member that Germany would allow it and Austria wouldn't. And how in the heck that we can't get some kind of global, obviously I think that's maybe ridiculous, but a global, kind of governing board or something that I can't even imagine. Germany says it's okay. Austria says it's not. It's so interesting. You have it from state to state too within the states, yeah. But it's so interesting that it's so relatively harmless. It's harmless.
It is completely harmless.
It's harmless. It goes the other. If anything, it helps. It can't hurt you at all unless you drink too much water. I mean,
It's
it can't hurt you.
no, it can't. It cannot harm you. And there are so many reasons I think why it's not being allowed here. There's a certain amount of I dare to say, because I'm speaking in English, greed in the medical community. It's Austria is mind-boggling. So as a doctor, as a pharmacist, or as a midwife, you're allowed to practice homeopathy. A doctor can use fully, and a pharmacist can go to an acute book and look up symptoms and then give a remedy. And then there's the midwife who's only allowed to work in the realm of childbirth and delivery, or pregnancy and childbirth. But say I'm Monica, the layperson, and I have a cold, I can go to any pharmacy and they can give me a remedy, and I can buy it anywhere I want. But Monica, the homeopath, is not allowed to give it to you. And because it is a purely energy medicine, anything over a 30C potency is a purely energy medicine. It is completely harmless. And I'm considered in Austria, my title is an energy worker. That's the title I operate under. And if you read, it's a 30-page or 40-page document of all the things you're allowed to do. And it takes homeopathy. It's word for word, removes homeopathy out of the allowed types of therapies, despite the fact that it's an energy medicine. So don't ask me what the reason is. I'm also employed by the Austrian, what's their word? What are they called? It's the governing body of homeopaths in Austria, and I teach for them. But I'm only allowed to teach philosophy and history because I can't teach anything that might harm someone. And I think that the reason initially, or maybe the more harmless reason why they don't want people treating with homeopathy is because they're afraid we won't recognize severe illness or acute or emergency situations. And so I said to the president of this association, so why don't we teach them in case they run into a situation where a patient is having a heart attack in front of them, et cetera, et cetera. And he said, we've tried, but over the years, they've had every brick thrown under them possible. It's just not being allowed. And as the years go by, they have less and less students every year. And they were working, I'm not sure if it was in conjunction with COVID or if it was already happening anyways, but the whole school, which was an in-person attendance school, has now been switched over to online because they just aren't getting enough doctors to educate themselves in homeopathy. It feels a little bit like it's a dying art here.
Wow. And I heard that the Queen, she used
very much. Yeah. Peter Fisher was her homeopath. He was the doctor, I don't know what they call it, a special name, but the physician to the Queen. But he was a homeopath, and their whole family was treated almost exclusively homeopathically in certain circumstances.
That's fascinating. All right, Chanel.
I have one quick question because we're nearing the top of the hour. Mm-hmm. As a supervisor and having been a supervisor for quite a few years, what would be the best advice that you would give to a new homeopath or a starting homeopath, student homeopath? What was the best advice that was given to you?
To me, know your materia medica. Everything gets easier once you know your materia medica well. And know how to take a really good
people who may not know what that is.
The materia medica are the books that list all of the symptoms that occur in any given remedy. And if it's a small remedy, there might be a 1 page written about it. And if it's a big remedy, there might be 200 pages written about it. But there are still things that are called keynotes or leading symptoms. And those are the things that you need to know and study so that you understand what the remedy does, what the most striking symptom about a remedy is that stands out in the person when you meet them.
Well, you are a great guest, Monica.
Thank you.
All of our questions. And we thank you for being here. Chanel, you want to?
Yeah, definitely. Thank you so much, Monica, for joining us today. And we'd love to have you back, whether it's for an event or a health and show, maybe sometime next year, but you are always welcome to join us.
Be my pleasure.
We would love to have you. I can say from experience that you have so much knowledge. You helped me so much when I was a student. So
thank you. That's nice to hear.
So definitely
thanks for explaining all my questions. Well, answering my questions, because I got a lot. So what we got going on here with HWC?
So we have a couple of things going on coming up this month and next month. So we've got Roger Savage will be joining us on Wednesday, the 21st at 10 a.m. Eastern Standard Time. He will be kicking off our new Contemporary Masters series. He will also be followed up in October on the 22nd at 10 a.m. by Frederick FROHMANN. So please join us for those. We also have the recording of the Book Club from this month should be up. And we had Jerry Cantor on talking about Sane Asylum, his book. So please check that out. And that's all from my corner of HWC. But as always, it was a pleasure.
Chanel's got a big corner. Corner's the market. Anyway, we thank you all so much. Monica, just before we end, do you have a website you want people to visit, anything like that?
Sure. I have a website. It's FROHMANHomeopathy.com. So www.FROHMANHomeopathy.com. You can also email me at monica@FROHMANHomeopathy.com. And once you're on there, if you are interested in making an appointment, you'll see there's a link to a scheduling calendar. Or if you have any questions, I'm always open to answering any kind of questions.
Good. Thank you so much for being here, everyone out there. We love it when you show up. We feel your energy here, and it feels really good. If you want to know what it feels like. And thanks, Hamnan and Chanel. Love you bunches, and everybody out there. We're so happy you came. Come see us again the second Tuesday in every month. We will be here. Chanel, any final closing words?
No, it was a pleasure as always to be on the show, and hope to see everyone again soon. And if there's any information that you missed from the show, you can always check us out on Facebook at homeopathyworldcommunity.com or on Facebook, and then at our website, homeopathyworldcommunity.com. And if you have any questions about Monica, you can definitely reach me there, and I can send you in the right direction to find her.
Perfect. Monica, closing word?
I think you actually used the words already today, but I'm going to repeat them. Just try it. Why not give it a go? If you haven't already, if you don't have a homeopath, it doesn't have to be me. It can be anybody. I mean, I have a virtual practice, but really just try it. Go to anybody and get an idea of what it can do for you.
Cool. Great. All right, everyone. Have a wonderful day. Bye.
Thank you. Bye-bye.
Bye.
You are tuned to the Nissan Communications Network. If you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it in the archives section at nissancommunications.com. Don't forget to subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Sponsored by StreamingGear.com, Carolina Apparel, and DeltaForce.net.